Warning, censorship. Warning, censorship.
Our government has made us suffer through their inhumane COVID-19 restrictions for almost a year now. But the sad thing is, not everyone could survive them to this point. While we are repeatedly told the lies that staying home equals staying safe for all, and that we're all in this together, I have some documents that will show you sobering statistics about how that wasn't the case during the first 5 months of this mandated new normal. Now, I highly doubt that these documents will be the last of their kind for us to go through, but nevertheless, we're going to pick through what we have here today. Drea Humphrey here with Rebel News, and after I go over these statistics with you, it's going to be clear just how much the decisions of our health lords and bureaucrats, and even the pro-lockdown advocates who constantly pressure them to do just that, lock us down, are putting Canadians at risk. Early on, after the COVID-19 pandemic was declared, it gave license for those in charge to make knee-jerk reaction type restrictions on our people. Sure, there was a time for a little bit of a grace with that. I mean, they didn't know exactly what they were up against, right? But now, the just for 2 weeks promise has morphed into nearly a year of harmful COVID-19 restrictions being forced upon us, and those who dictate them to us being silent about their consequences. Early on, we could see huge red flags indicating that the lockdowns could likely be more deadly than the virus itself. Domestic violence calls surged across the country. Crisis calls to kids' helplines skyrocketed, even as high as 70% at some centers. Isolation was destined to correlate with heavy substance abuse, and despite our hospitals being empty, essential to-life surgeries were all of a sudden deemed non-essential. But it's only now we are starting to have access to tangible statistics about just how deadly these COVID-19 restrictions have become for us. This right here is an inquiry of Ministry to Government of Canada. It has some absolutely horrifying statistics in it. Let's start at page 2. Would you believe that outside of Quebec, an estimated 335,591 surgeries were cancelled or postponed up to June 2020. In British Columbia, where I live, 58,904 were cancelled. In Alberta, 31,727 cancelled. Ontario, 175,832 cancelled, all in a span of 3 months. And no, those were not boob jobs, not all of them, my friends. So exactly how many of those cancellations resulted in deaths of Canadians or shaved off a few years of their life? Now, I've interviewed a couple of family members of people who lost a loved one, not from COVID-19, but most likely from the COVID-19 restrictions. Like Jerry Dunham, for example, a father of 2 who sat in a next-to-empty hospital, absolutely dumbfounded about the death sentence he had just received when he wrote this Facebook post. So I was basically told that the government is willing to risk my life to save my life. Let me say that again. My government told me they're willing to let me die, which according to them is for my own safety. Can you imagine? His 2 little girls lost their father because the government's mandated new norm deemed his pacemaker non-essential. To learn more about the Dunhams and his family, you can head to rebelnews.com and watch the report I did there with Krista Lambert, Dunham's friend and mother of his 2 children that he's left behind at rebelnews.com. But let's talk about our fatal overdose crisis first. One that continues to soar since these restrictions have been placed upon us. Dr. Tyndall, a Toronto-based infectious disease doctor with a public health background, told CTV in between long pauses, "So many have died, and man, I've seen a lot of people die." Again, that wasn't about COVID-19. In his case, he was talking about how we are now experiencing more people dying from drug overdoses than ever before in Canada. Coincidence? I think not. Based on data available from the Canadian Institute of Health Information's Discharge Abstract Database, between March and August 2020, there were an estimated 29,573 hospitalizations resulting from substance abuse or overdoses, with the most occurring in BC with a total of 8,566. Now let's put that into perspective for a minute, shall we? If during March to August, British Columbia had seen 8,556 substance use hospitalizations, yet according to the BC CDC in January to August, our hospitals had only ever seen 567 people hospitalized with COVID-19. What exactly was the pandemic that was overwhelming our hospitals during the lockdown? On page 4, we see that between April and June 2020, 1,628 overdose deaths occurred in Canada, of which 97% were accidental, meaning that was a 58% increase compared to what we had seen in the beginning of the year, from January to March. Now, I bet you're wondering, what could have changed in March, right? Well, according to a Global News COVID timeline, that month was full of mass school closures, closures of public facilities, province lockdowns, and closing of businesses. No big deal, right? We're all in this together, right? Wrong. At least not when our health officials act like the restrictions don't play a huge, ginormous role in making people want to, actually scratch that, need to escape, even in some cases if that means abusing substances to do so. Now, what we just went through was only a few of the sobering statistics. Things are worse in some ways. We're seeing fines on Canadians who are trying to feed that very community out in the cold in the winter. It's out of control. Comment below and let me know what you think of this. Drea Humphrey for Rebel News. Here at Rebel News, we tell you the other side of the story, but that doesn't come without a target on our back, especially when it comes to matters of censorship. What I suggest you do, if you like this report and you want to keep in touch with us, is head to rebelnewsplus.com. There you can subscribe to our exclusive content and have access to everything that we do. And by the way, everything that you do there, if you purchase a membership, goes to actually funding the work that we do here, and we appreciate your support.